Okay, so many questions really about this evolving situation. What do health experts think, and where do we stand on treatment? I want to bring in Dr. David Winter from Baylor Scott and White Health to help answer some of these questions. Hey, Dr. Winter, thanks for being here again with us today.
Hey, Sonia, glad to be here.
So first off, I mean, we don't know exactly what the governor is going to announce in about an hour, but I would imagine that he's sort of following the federal government's blueprint here. What are your thoughts on this sort of gradual rollout that we're likely going to face?
Well, I'm excited for the economy for that, but I'm worried about the people. That virus is still out there. We've done a wonderful job of this distancing and this hand hygiene. Now the masks have made a big difference. We're going to have to be careful. We need more testing. Testing is on the way. We're told a couple weeks, maybe we'll have plenty of testing. Maybe, I hope so. But right now we don't know who out there has the virus, who doesn't. And if you haven't had the virus, haven't had contact, you are still very vulnerable. This virus is still highly contagious and dangerous.
So what would you say to people who go, you know, I don't know if I want to reopen my business right now, or, you know, I'm 70 years old, I have type 2 diabetes, should I be going back into the grocery store? What, if these were your patients, what would you tell them?
I think that the very vulnerable, you mentioned the diabetes, those with heart problems, lung problems, immune problems, the very elderly, those people all still, I think, stay home if at all possible. If you're going to get out, well, get out and just take the precautions. Now, we know that 6 feet works most of the time, but there was that case in Washington State where the choir was out there singing, they were 6 feet apart, and 2/3 of 60 people came down with the virus. So the mask is an added protection. I'm going to wear this mask wherever I go. I keep it with me. I'm going to put it back on here in a moment. So take precautions, because that virus is still angry and it's still the invisible enemy, as they say.
Yeah, and it's not going away. Okay, so you got your mask. I'm glad you showed everyone this mask. Can we talk about how to properly put it on and take it off, first of all? And then also, you mentioned wearing it wherever you go. Where exactly is that? I mean, if you go out for a jog, are you going to be wearing that mask?
Actually, I've done that, Sonia. What I do is I take it with me. And if I see I'm going to get within 10 feet of somebody, I'm going to put it on. But I like to go where there's nobody out there. So, no, I don't have it on all the time. I don't like this any more than anybody else. Now, as regards to the mask, any mask covering works. In fact, these surgical masks, we need to save these for the hospital workers. So those N95, we definitely don't want to be using those. But a cloth mask will work. The main thing you want to do is have it where it's around your mouth and nose, and it's fairly tight. You don't want air, you want the air going in and out through the mask, not around the sides. That's the best way to use a mask. But any mask is better than no mask.
And, you know, make sure that it's fastened. And my fear or my concern with everyone wearing masks is that their hands are going to be right by those mucous membranes all the time if you're moving it to talk or moving it to, you know, chat on your cell phone.
That's a great point. If your hands are touching this mask and COVID virus is on the mask, then you touch your hands to your face, you're going to be vulnerable. The best way is to only touch the fasteners of the mask, put it on, take it off, and don't touch the outside of the mask at all, because that actually can be contaminated, then to your hands, then to your face, and you've got the virus in you.
Okay, so Dr. Winter, I told my friends on Instagram that we would be chatting today, so I've got a question here from one of my followers who says, are we able to grab a bite once a week with friends? It's only 3 of us, and I presume this means like once some of these restaurants or bars reopen. What would you say?
Well, here's what you need to remember. We think anywhere from 25 to maybe 50% or more of people have the virus and don't know they have it. So you don't know if your best friend got it from somebody else and is going to give it to you. I'd still be very, very cautious about this, because these people who are asymptomatic, those are the ones, it's not their fault, they don't know they have it, but you don't know if they have it either. So we've got to distance, we've got to wear these masks. So, you know, we're doing distancing in the backyard with maybe 10 feet away. I like doing better with Zoom or Apple FaceTime. That's the safest way. That virus tends to get out there and get you, so just beware.
So trying to stick with people who live, I guess, in your own house or apartment. And when it comes to, you know, as we kind of start to relax these rules, so to speak, is there any particular advice that you have for people with children once people start commingling again?
Yeah, children we think are the highest population who get the virus and don't know that they have it. So be careful with those. Now, if you've been exposed to the virus or been with somebody and then you're 14 days out, then you're fine. Another thing to know, if someone has the virus without symptoms, they kill the virus within 2 weeks if they have no symptoms at all. So those folks are going to be fine. So it's not like you have to avoid everybody, but keep a small nucleus of friends with you. And if they've been without contact for 2 weeks, they are all fine. But again, I push these social discussions. We love talking to the family. I've got family all over the country, and we get together once a week for a happy hour at 5 o'clock, and we all get on we use Zoom right now, and it works very well. That's the safe way to do it. Anytime you're out in the public, you have to be careful and take precautions.
All right, Dr. Winter, that's our time for now, but I'll email you some of the questions that I've got coming in still through Instagram. Of course, appreciate your time as always.